Okay.
Thank you so much, everyone. Welcome to a very special Fam Health session that we are doing as part of our coverage on the coronavirus crisis. Today, we will be speaking with Dr. H K Chopra, who is one of our near and dear friends and also an esteemed cardiologist currently at Mulchan Hospital. And we just want to say, first of all, thank you so much, Dr. Chopra, for coming today and speaking to us a little bit about coronavirus.
Thank you, Sanjana.
So just to get started, I mean, I think one of the difficult challenges about coronavirus is that it changes every day. And today is now March 31st. So we will speak of the virus as it exists today. So right now, sir, in your view, what is going on with coronavirus in India?
Yeah, I think, Sanjana, it's a very, very important question you asked. If you see every 24 hours, the scene is different.
Yep.
What it was yesterday, it's not today. And the rate today, if you see the burden, is almost 7.8 lakhs in today's date all over the world, which is very alarming. And if you see the mortality, the global mortality, as it's a global pandemic and it's very challenging, the mortality is almost 37,000. Yesterday it was 35,000 and today it's 37,000. So it's almost like 5 to 5.3% global mortality. And if you ask the data today, that 199 countries are in the grip of this crisis of corona. And out of 199 countries, the highest mortality has been seen in Italy, which was 11%.
Yeah.
And the second country which is having the highest mortality is in Spain, 9%. And then 6% is the mortality which is seen in UK or Iran or France. There the mortality is also in the trend is almost third or fourth in number.
Yeah.
Then we see other countries like India or US. In India, the mortality is 2.87% today, while the mortality in US is about 1.76%. The lowest mortality seen in the world today is in Germany.
Okay.
Because they are better equipped.
Yeah.
Better isolation. And if you see the number or the trend of rise of number of patients, once upon a time, it was highest in China. And the mortality in China is still about 4.4%, whatever is known to us. And now the trend is highest. Then it shifted to Italy and Iran and South Korea. Today, it is highest in US, so 1.4 lakhs. So out of 7 lakhs, 1.4 lakhs patients are in USA. So New York is like an epicenter in corona so far as US is concerned. And very painful to say, in India, yesterday itself in Delhi, 163 patients erupted from Nizamuddin, which was a very, very painful. And then all people gathering together, they have some kind of function. Same thing is happening in Noida. So the seed is changing, the mortality is becoming high. It's really a matter of great concern, not only for India, but for the whole globe. And we have to work very hard. And I firmly believe our strategies should be known to everyone. Doctors cannot do much. Doctors have a limited role. All healthcare workers have a limited role. And their role comes if we are not able to take the preventive measures as suggested by the various governments of the global government, like WHO, or in India, it is by Ministry of Health, Government of India, ICMR, as well as by Drug Control General of India.
Okay, and so in your view right now, I mean, again, this changes every day, but do you think it's settled now how this thing is transmitted?
I think this is a very, very pertinent question.
Yeah.
Will it settle down? That's our concern also.
Yes.
Every man, every human being is concerned what we should do so it can settle down early. I think we have to understand what is the mode of transmission, what are the routes of transmission. Once we understand this, I'm sure we can halt the rising menace of corona, our country as well as in the globe. Sanjana, the mode of transmission is usually asymptomatic and symptomatic.
Okay.
Symptomatic means the people who are suffering from COVID-19, they are the source. They can be a direct source or they can be indirect source. While asymptomatic is usually contact.
Yeah.
And if you see the real viral burden is in contacts. More than 70% burden or 75% burden is in contact. That means the isolation is the need. That means the social contact awareness is the need. And I think which our Prime Minister, I'm really grateful to our Prime Minister of India and the Health Minister of India, who are very quick, very timely, very fast, very meticulous in implementing this program in India as compared to other countries. But we are still lacking in clusters, in the areas which are remote, where the literacy status is less. The message is not going so effectively as it should.
Yeah.
They're still not following their own methods of prayer, social get-togethers, and that's how the problem is arising.
So one thing that I've heard a lot, and I agree that India has taken very strong moves towards, obviously, we have put 1.3 billion people in lockdown, which is completely unheard of and almost the most extreme measure that any country has taken, including China. But I think there are, and I understand that on the one hand, but I think there are a few questions about that. Like, for example, the situation with the migrant workers now, that video has gone viral with all these workers that are trying to get out. And I think then UP started a bus service, and the bus station now has, thousands and thousands of people, obviously not social distancing in any way. And it's been said that in a sense, lockdown and social distancing is a bit of a privilege because people like you and I, well, not you, because of course you are out there saving lives, but people like me and others can sit at home because we can afford to take the time off. We can distance ourselves because we can afford to have some distance from each other. We don't live in a situation where social distancing is impossible. And, we can wash our hands because we have clean water. In that context, how do you think, what do you think is the solution, for example, for the issue with migrant workers?
I think the best decision which government of India has taken is lockdown.
Yeah.
I know it was an abrupt decision. There was no time given. So the problem is arising because of the time lag. People were not prepared, especially the daily wage workers.
Yeah.
Who come here from Bihar or who come here from UP. They were not prepared, they were not geared, and they are facing a real problem. So we need to isolate them well in time and provide all the daily needs, what they need.
Yeah.
It is only because they are deprived of those needs. So they want to go back to their own place.
Right.
Like in UP or like in Bihar. And that's how, as you rightly pointed out, Sanjana, that they got stuck at the border and there are no arrangements of the travel. So there is a lot of chaos there.
Yeah.
And it's this chaos which may enhance the problem of COVID. So we need to work really hard and make sure that we halt the travel and try to arrange something for them wherever they are, either in the form of isolation homes or in the spiritual places or in the schools or in colleges or in the hospitals or hotels, motels, guest houses.
Yeah, anywhere.
Wherever. It's possible.
Isn't one of the issues that if this, what is going to happen, what happens if this actually does get into rural India and into, the places, that don't have the healthcare infrastructure that we have in the metros?
I think it's a real problem. We cannot compare ourselves to Italy. We cannot compare ourselves to United States. They are very well equipped.
Yeah.
And they are facing a problem. In United States, there are no masks. There are no gloves. I was discussing with the anesthetist just a few days back in New York, and she told me that she is intubating the patient, putting in a tube or putting a ventilator without a mask.
Wow.
So it's high risk.
Yeah, I've heard that people have to make their own masks in America. Like doctors have to make their own masks with note
So
cards.
it's a real problem. We must provide more masks. We must provide more sanitizers. And above all, is education, 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 as our Prime Minister directly and our Health Minister advisory, emphasizing on like hand wash frequently, every 1 or 2 hours, maybe 20 to 40 seconds. And they must understand the method of washing. It should not be superficial method of washing. They must sustain, take some time, washing in between the fingers, washing on the one part, and the other part, and at least for about 20 to 40 seconds. More often is the only way. Why it is so? The reason is this virus is a large virus and it stays on a smooth surface longer time as compared to a porous surface for a little less time. When I say longer means 10 to 12 hours. And for a porous surface, maybe 8 to 10 hours. And also it stays at least for a few minutes. And the mode of transmission, as I mentioned to you, is usually not by aerosols. It is by droplets. When a person coughs, millions of virus load is coughed out. And this virus, being a large size, is not able to travel a distance of more than 1 meter or 3 feet. So our objective is more hand wash, isolation, and provision of sanitizers and masks for as many people as possible so that we can prevent the invasion of this virus. Because usually this virus needs hand hygiene, respiratory hygiene, and the general hygiene. If we take all those, for example, I just tell you my example, like when I go to the hospital, I go and clean my car with a sanitizer and with a spray. I clean my steering, I clean my pen, I clean my wristwatch, stethoscope, because I use on a patient. And if I use a same stethoscope or bring elsewhere, it's going to cause a problem. My BP apparatus, thermometers, even the patient's documents which come to me, I don't see them directly. I put in a separate file. And then I use gloves because I do a lot of echoes in my patients. So I take all the precautions, whatever is possible, what we call as the universal precautions.
Yeah.
So everybody should focus on the universal precautions, which our authorities are emphasizing repeatedly from Government of India. And we must work on it. Isolation and preventive strategies are the only ways to halt the rising menace of corona pandemic in India and in the world.
And what are some of those preventive strategies for the common man that you mentioned?
I think the best thing is frequent hand washing, as I mentioned to you. Number 2, it's very important to take care of the respiratory hygiene. Very, very important. Not to cough or sneeze on anybody. You can use the right hand elbow so that you can prevent the exit of the viral load on somebody else. And of course, you have to create local hygiene. I keep my apron, my white coat in my car. I don't bring it here. Whatever mask I use, we dispose it off after use for 24 hours. So all these hygiene is very need of the hour. I brought some bread yesterday.
Mm-hmm.
So I was told the packet where it got covered should be properly taken care of, disinfected. Then the plastic cover should be disinfected. So many precautions one is to take. So preventive strategies is the only method, not to get together in the crowds, social distancing, wherever you are. At least 3 meters distance is a must, which everybody should follow. If you do that, at least a 3 feet distance and 1 meter distance. So they are all the preventive strategies which we have to continue and stay at home. My message is very important and very clear to our country and the globe. First message is stay at home. Second message is stay at home. And third message is stay at home. If we really want to be safe, healthy, calm, and successful to uproot the rising menace of corona.
Great, thank you so much. So my next question is a little bit around symptoms. So I think we sort of, the public knows now, I mean, you got a call, if you try to make a phone call now, it says coronavirus. So I think everybody knows that, you know, one of the main symptoms is a cough, which of course can be anything. It can be allergies, it can be any other kind of virus, it could be a bacterial infection, it could be a number of things, right? So, I mean, when is it time for someone to start thinking more seriously about whether this is coronavirus? And in your opinion, and again, opinions vary widely on this, but in your opinion, if you are experiencing mild symptoms, should you get a test or should you not get a test?
Yeah, Sandhya, I think it's a very important practical question because we really get a lot of calls and we have to understand that if you have only cough, then you're not to worry at all because cough can be because of allergy or other viral infections. We shouldn't bother. But if you have high-grade fever with a dry cough, we suspect corona as we are having a pandemic now. If anybody has cough, fever, and breathing difficulty, we should hospitalize such patients.
Okay.
So our instructions are very clear in our emergencies and the critical care areas that if there are 3 symptoms, they should be sent to the COVID centers of COVID isolation and they should be looked for all this and they should be tested for all this. I think it's a very important question which you asked. We tell our patients, if you have just cough, take these medicines by telemedicines or teleconsultation now. If they have fever and cough both, we tell them kindly report to the COVID center so that we understand the intensity of the problem and we examine the patients and then advise them accordingly for the COVID testing. COVID testing is a very hard topic because in the beginning, the COVID testing was so infrequent.
Yeah, and I mean, that's actually was my next question because I think it's been a huge issue. I don't know, I'm not sure about here, but especially in the United States where there was a major testing failure. And because of that now, some might say that the US is in the situation that it's in. So I mean, I'm not really completely clear because I don't have that information, but on what is the testing capability in India? How are we doing in terms of testing?
Yeah, I think it's very pertinent in our country that COVID testing should be intensified. Government alone will not be enough. We need to have a lot of private labs who are accredited labs, and we should try to do this testing. Usually they use a PCR method, or they also use sometimes what is known as instantaneous testing in 15 minutes, which is just by antibodies. But the proper testing is by immunofluorescence technique. Our objective is testing should be more often so that we know the exact scene of this pandemic. Now the question is, who are the targets? Who are the patients who need testing? First, asymptomatic people who are coming by travel, anywhere from outside, they are all to be tested. Number 2, asymptomatic household workers who have a COVID patient in the house, they all should be tested. Number 3, or healthcare workers who are in touch with the COVID patients, they should also be tested. And number 4, any patient admitted in a hospital with a breathing difficulty and fever, we should suspect that he or she is a COVID patient. And whosoever is examining, healthcare worker, maybe a doctor or a paramedical staff or intensivist, they all should be tested for COVID. And the quarantine period, we say from 5 days to 14 days. After 14 days, we must also test, are they still positive or still negative? So it's a big spectrum of individuals testing. And real data will come to know after we test a lot of asymptomatic, symptomatic, and those who had an exposure to symptomatic or asymptomatic patients. Because the real viral burden, as I mentioned to you, Sanjana, is 80 to 85% are asymptomatic. Because the recovery rate is faster. 80% people just recover without taking any treatment. It's the remaining 15% who have a high mortality and high morbidity. The second point I really want to emphasize at this particular juncture is that we have seen elderly patients after the age of 60, they get all kind of complications. Underlying morbidity in the form of heart problems like coronary artery disease, or they have hypertension or diabetes, or if they have cancer or a chronic kidney disease, or they have some underlying skin problems or immunodeficiency, they have a higher mortality and high morbidity. All people after 60 should not be exposed to COVID patients if you want to reduce the mortality. What has happened in Italy? All the people who died, most of them were about 60. They were not knowing. And some of them had occult heart problems. Some of them had overt heart problems. And most of the people after 60 have occult heart problems. So I think this group of people who are above 60 should not be exposed to COVID patient. This is a very, very important precaution. And I think testing should be more frequent, and all the universal precautions should be intensified, and isolation is the need of the hour. And social distancing, physical distancing, and of course, emotional distancing are all necessary to reduce the pandemic of corona. You asked me a very good question. What is the time when we can say that we are safe and the disease is not rising? The answer is very difficult. But the reason is we are in phase 2, and if we enter in the phase 3, it's going to be disaster.
And so
because we are not equipped in India, we are not equipped. So we will not be able to handle so many patients like it happened in Italy. Mortality was so high.
Italy couldn't handle all of its patients. So, I mean, obviously being in India's position is completely different. But again, just to ask you a question about that. So what are hospitals now doing to prepare? I mean, we're still in the stage where we've only had, under 5,000 confirmed cases, although I'm sure that'll grow, that number will grow with more widely available testing. So what are hospitals doing? Because obviously that's not enough people that, right now hospitals are flooded, but it might be the case that they will be soon. So what are hospitals doing to prepare?
Yeah, I think it's a very good question now. So advisory has come from the government of India to most of the hospitals to create a isolation wing, which they call as a COVID wing, COVID hospital, or COVID center. And they are trying their best to equip this particular unit by all the gadgets like ventilators, masks, and the doctor's protection methods, so that there should not be any problem when we receive a real bulk of patients to handle. Like I just heard this morning that the whole trauma center in All India Institute of Medical Sciences is converted into a COVID center.
Wow.
Similarly, 2-3 floors of Max Hospital are taken over as a COVID center. Even in army hospitals, Air Force hospitals, Nair hospitals, Navy hospitals, they have all made very big centers. And even GB Pant Hospital, like with the outbreak of so many positive patients in Nizamuddin, LNJP Hospital, and they have taken some hotels where they're making it quarantine centers. So hospitals are working hard. This is one. Second important component, train the staff. We need many doctors. We need many resident doctors. We need many intensivists. We need trained nurses. So every hospital is running training programs for the doctors, paramedical staff, and the junior doctors, senior doctors, so that especially in the respiratory medicine and the internal medicine, and the critical care people, they have to work as a task force. So we are trying to prepare as much as possible as per the guidelines given by Government of India as well as by ICM.
Okay, and once we are prepared, what have doctors been told to do to take care of themselves? Because I think health workers are obviously especially at risk, and I think that's been an issue in other countries that we've seen. And to what extent are we informing ourselves from what's going on elsewhere in the world?
I think it's a very, very important question. We need to take care of our healthcare workers now. We cannot ignore them.
Yeah.
We should respect them, take care of their diet, take care of their hygiene, whether physical, hand hygiene, respiratory hygiene, and they should be provided with the mask. We must ensure that there is no deficiency of mask in any hospital, no deficiency of gowns or caps. They should have a complete infrastructure to be taken care of by the doctors. When they work for a COVID patient, they need to be quarantined for 14 days. We must make a phasic change in the doctor duty rosters or duty protocols so that they don't fall victim to COVID. If the mortality becomes high, you'll be surprised, Sanjana. I saw a news from Italy that 25% of doctors died.
What? Wow.
In Italy, very painful. So if the healthcare workers are not taken care of, I'm sure we will create disaster for our country. Who will take care of these patients?
Exactly. Wow.
It should be on the top priority. Government of India and every organization should focus on the health of the health workers so that they can take care of the COVID patients very effectively and meticulously.
Okay. So moving on a little bit to the timeline for the vaccine and possible treatments or preventive measures that we can take. I personally have been receiving a lot of WhatsApp forwards about hydroxychloroquine or chloroquine, and then I've been reading a lot of articles about some couple in America that took chloroquine phosphate and then they passed away. And so just what is your view on chloroquine and that family of medication?
This is also a very hard question. You're asking all hard questions.
I'm not going to ask the easy ones.
Number one, vaccine. There is no vaccine so far. So the answer is no. But vaccine is the answer. And I'm sure United States, Johns Hopkins Hospital is working very hard. And we presume shortly the vaccine will be available. Then things will change. Number two, there has been a little controversy on chloroquine versus hydroxychloroquine. And recently, I'm sure you are aware of, that there was an advisory from ICMR, that is Indian Council of Medical Research, Ministry of Health, Government of India, and Drug Controller General of India. They created a national task force. And the task force studied very hard the various logistics, the data on the usefulness of chloroquine or hydroxychloroquine in the prevention and treatment of COVID-19. I would just like to interact with you on this issue that it has been proved beyond doubt in a study from France that hydroxychloroquine was the game changer in the treatment of COVID patients,
Okay.
along with other antiviral drugs like we've been using in India also, and some of the antibiotics they've used in a protocol and treated this patient for 10 to 15 days, and the recovery rate was faster and the death rate also reduced. So that's how we labeled hydroxychloroquine as the game changer in the treatment. Now the question was, where are we for prophylaxis as a preventive measure? So the advisory from Indian Council of Medical Research is very straight and very meticulous and very restrictive. That hydroxychloroquine had been used previously for last 4 decades or 5 decades in rheumatoid arthritis or collagen disease, autonomic disorders. So they said that this drug is an anti-inflammatory drug, proved beyond doubt. And they mentioned that in all people who are suffering from COVID-19 had a real spurt of cytokine. This cytokine burden is responsible for so-called adult respiratory distress syndrome or respiratory failure or respiratory insufficiency. And the cytokines are liberated because this particular virus, which is a large virus, it affects the lysosomes in a cell and make the pH more acidic, so that there is a gush of cytokines and may produce a storm in the lungs and death. When we give a drug like hydroxychloroquine, it acts at the level of lysosomes.
Okay.
Thereby changes the pH by making it more alkaline. It reduces the burden of cytokine liberation and cause immunomodulation. So we reduce respiratory distress and save a lot of patients. This logic and mechanism was seen superior with hydroxychloroquine as compared to chloroquine. The chloroquine has been used for malaria. It has also been used for amoebiasis. It has been shown in South Africa that chloroquine toxicity is more than the patients of malaria once upon a time. Mm-hmm. They mentioned the chloroquine is more toxic as compared to hydroxychloroquine. Okay. It will produce tinnitus, what we call a synchronism. It is also known as deafness, may cause eye or macular degeneration, and may create skin problems, enhance psoriasis, psychosis, depression, anxiety, dizziness, so many problems. Even the blood dyscrasias or anemias are known with chloroquine. Hydroxychloroquine has been found to be superior as compared to chloroquine. The most important message today in this controversy is that we must understand the benefit and risk ratio. If the benefit of drug are more than the risk, then drug to be used. And number two, we should understand how does it help. So the understanding the mechanism is clear with the hydroxychloroquine. Now, what is the advisory? The advisory says that first of all, we should know the cautions. Hydroxychloroquine should not be used in any individual less than 15 years of age. Very clear?
Yeah.
Number two, hydroxychloroquine should be used when you are exposed to a COVID patient. Now, this is divided into two categories. Category one, household. When there is a COVID patient in the house, for household workers, they should use prophylactic hydroxychloroquine, and the recommendation is they can be given hydroxychloroquine 400 milligram twice a day on day 1 and subsequently once a week for 3 weeks. And this should be prescribed by a registered medical doctor.
I think that's more of the issue that I have noticed is a lot of people, I won't say panic buying, but certainly trying to buy chloroquine, hydroxychloroquine over the counter at pharmacies or at the chemist. And that's, I think.
That is not right.
Yeah.
No chemist should give anybody without a prescription. It is unethical, illogic, and some action should be taken against its chemist. Nobody should give medicines without a prescription. A medical registered doctor whose DMC or MCI number should be there, they can prescribe this drug. Second very important issue, for healthcare workers, the ICMR advisory says and recommends that all the healthcare workers, whether they are doctors or nurses or a paramedical staff, they should also use this drug if they are exposed to a COVID patient. If they are not exposed to COVID patient, they should not take it. Again, the recommendation is 400 milligram twice a day on day 1 and 400 milligram once a week for 7 weeks. I think there is no ambiguity.
Yeah.
The advisory is very clear that, again, a word of caution. And the caution is, in elderly patients who have underlying heart problems, liver problems, or kidney problems, or skin problems, or especially if they have a macular degeneration of eye, this drug should not be used without a specialist clearance. For example, I don't want to say a technical word because it usually prolongs the QTC interval. That's an electrocardiogram. So if anybody's got blocks in the past, like a left bundle branch block or a right bundle branch block or some blocks, we should be very, very careful, or a cardiomyopathy. So it should be under the domain of the specialist to see which heart patient it should be given and which heart patient should not be given. Similarly, kidney specialist. If the potassium level is very high and they're taking some drugs where hydroxychloroquine may interact, it should not be given. So I think the prescription-based recommendation is the need of the hour.
Yeah.
But a common man should not go to chemist shop and ask for this drug. So this is a very clear advisory, and I don't think there is any ambiguity about the indications.
Yeah.
So
I think people are just a little bit, ask so many things. When you have an unknown in front of you, you try to do everything to get that unknown out of the equation. So I think that.
Sanjana, you asked me some very difficult questions today.
I have one last difficult question for you.
And they are very important.
Yes, which is, so as a cardiologist, I mean, and obviously there is a lot of risk associated with heart disease and coronavirus. Is there any worry in the medical community about the amount of respiratory patients that we have in this country and the impact that coronavirus could have on that?
Yes, very good question. See, as we know, that the air pollution is very, very common in India. And in India, a lot of smokers.
Yeah.
You raised a very good question. If you see, the death rate was higher in Italy in elderly, and those elderly who were chronic smokers. So all people who have an underlying respiratory problem, they have more complications and higher death rate. And in India, the respiratory problems are very common.
Yeah.
Besides the bronchitis, they also have tuberculosis, COPD, allergic bronchitis or asthma for a long time. So their lung reserve is poor.
Yeah.
So they are highly vulnerable. It's a very pertinent question in Indian content. And in Indian context, we see a lot of air pollution everywhere. That's how the lung reserve is very poor. I remember a guy, Dr. Arvind Kumar from Gangaram Hospital. He is the chairman of Lung Foundation. He's a surgeon. He operates on the patients. And his message was very vivid. And he said that the lung reserve in Indians is very, very poor. And on the top of it, if COVID comes, it will be a disaster for India. So I think the message should go, since they are smokers, BD and hookah users more in India, air pollution is more, pulmonary is more, respiratory problems are at the peak, and on top of it, if this comes, I mean, it will create a real problem for all of us. So respiratory physicians are very busy these days.
Yes, I'm sure.
Medical care people are very, very busy. So I think it's a real problem. And I personally feel in a place like India, where we are not so sound as compared to the Western world or European world, so far as the tertiary healthcare is concerned, like intensive cares. So we need to work really hard to prevent our patient to go into phase 3, where there is an outbreak of this pandemic, and it will be difficult to handle.
Okay, great. Thank you so much, and thank you for joining us today. If there's any other message you would like to get out
Yeah, Sanjana, I think it's very important. My last concluding message with you today is that everyone, whether a healthcare worker or a non-healthcare worker, every citizen of India, child, young or old, men or women, everybody has to follow the preventive strategies. And my message is, again, with folded hands, please stay at home. Stay at home. Stay at home. Don't get panic. Don't make it a panic pandemic. Don't make it a anxiety pandemic. And don't make it a fear pandemic. We should learn how to cope with the disaster and not to become a victim of disaster. And it's in our hands. Take care of the health, take care of your nourishment, and have your exercise protocol. As we are doing today, we are sitting and watching and working and interacting. We should continue our daily routine as we do, but we should be very calm. A time will come, if we take all the precautions, COVID will be out of this planet. Thank you very much for giving me this opportunity to interact with you, Sanjana.
Thank you so much.
Thank you.